April is Autism Awareness Month, and it's a time of year where Autism Speaks and other groups, they help raise awareness, fund research, and advocate for the needs of the people, obviously, with autism. And joining us now, Diane Cahill, president of the Autism Coalition of Long Island, and Suzanne Reek. She has a son with autism, and she's executive director of the Nassau-Suffolk chapter of the Autism Society of America. Ladies, thank you very much for the time.
Nice to be here.
First, let's start with some of the math, because it's shocking to me. Maybe the numbers have leveled out in the last year, but if you go back 10 years, forget about 50 years, 10 years to where we are in the last couple of years with the numbers, it seems that there's been an explosion in diagnoses for this. Now, is that because we're finally doing it right? Is it because of environmental measures? Is there an overdiagnosis of it? What have you guys found?
It's a combination. Certainly, there's better diagnosis. Absolutely, I would think that's the first thing. People are more aware. School districts are more aware, the Department of Health is more aware. I think some children must have been misdiagnosed. We have adults now still being diagnosed on the spectrum. So I think that we're doing a much better job. There are people that believe there are environmental triggers. I like to base my opinion based on science, so I would say it's better diagnosis, and we have a lot of people thinking about it, and that's one of the good things about Autism Awareness Month, that people think about it a little more.
Now, it can cover the whole spectrum of not just the spectrum itself of autism, but also who gets impacted, predominantly males. White males, metropolitan areas, have that where you've seen the biggest clusters?
Certainly more prevalent in males, 2 to 3. As for metropolitan areas and more dense areas, I just think it's the population. It's more dense. I think the national number of 1 in 66 is a good number. It captures a really good idea of what families are dealing with. There's earlier diagnosis. Certainly having insurance reform passed in New York State has helped. So families have access to good screening and diagnosis through insurance. That's been helpful as well. But it's just something that every day, every month should be Autism Awareness Month for families that are living with it.
It just seems that, if it's not in your own family, you don't look too far to know people that are on the spectrum. And it didn't seem to be that way. Maybe because it wasn't diagnosed the right way or was called something different or whatever, but it didn't seem to be as prevalent. I go back 30, 40 years ago when I was in school, in terms of seeing the prevalence that you see now. Everybody, in your personal family, on your block, close friends, it's there, and it just seems like it's
I agree.
grown.
I mean, years ago, when I was in high school, when I was in grammar school, these are children that were typically disabled or considered slow or mentally retarded. I mean, there was a huge debate in this country about whether, originally, in insurance reform, the conversation was it was covered under mental health parity, and it had to really be that message had to be driven home to the administration in our state that this is a neurobiological disorder. So that research, that science, that's what's brought us to here today, where we have a better capture of numbers, there's better diagnosis, we know who really does have autism and who has something else. So it's important. We've made a lot of good strides, but we have to continue, finding out what causes it. If we can find out if there could be a cure, great. But the families that are living with it today, there needs to be something there for them. They're faced with early intervention, school-age programs, adult services. It's just tragic.
Well, let's put a human face on this. And Suzanne, let's talk about Joseph. We were saying right before we started, you were a member of the NYPD, and in fact, rose to rank as sergeant, if I have it right.
Yes.
You said far more challenging than anything you've had to deal with being on the job was raising an autistic child. Joseph, as we said, now 16. What has these past 16 years been like?
Well, it was very life-changing for us. You have a child who you're told at birth is healthy, you get the perfect score, and then at age 2.5, when I was going through 9/11, because I was a 9/11 responder, my son was actually misdiagnosed. So we took him to a neurologist, and we received the life-changing diagnosis that he had autism. We weren't given much, information on what to expect, what to do next. So when I became involved with the Autism Society, I was able to have an avenue to be involved with families directly and to try to make a difference in their day-to-day life and their quality of life. But my son is like having a 2-year-old forever. Unfortunately, he's at the lower end of the spectrum because, you know, with autism, it's a very wide range of abilities and disabilities for our children. And he doesn't speak. He has very difficult time communicating. He's, again, like having a 2-year-old forever where he needs constant one-to-one care. And it's just a simple thing like going out to a restaurant or going shopping for groceries is a challenge. So, you know, there's other groups that deal with the research, but what we deal with is trying to make families, their lives easier.
What are the questions, A, that you ran into yourselves, but also when families come to you and they're trying to navigate, what I understand at least, there's still a lot of bureaucracy, and parents not just have to be advocates, they got to fight for the kids because in a lot of cases, the local municipalities, the schools don't make it as easy as I know some of the autistic families would like them or need them to be.
Well, it is very challenging. In fact, there's not a lot of resources available. And, you know, with our personal story about my family is that we laid out over $100,000, about $112,000, to put him into a program that was appropriate for him. You know, we had a very difficult time. We had to sue our school district twice at a very high cost. It was our pension money. You know, I put all my pension money on the line to try to get the best place for my son to make him be able to be the best that he could be. So unfortunately, the family's a big stumbling block is that they don't know what's available to them. A lot of the minority communities also have difficulty with languages and accessing the proper services. And, you know, my son was misdiagnosed. So we had to seek out better form of diagnosis. Yep. And I think if you diagnose the children earlier, there's a better chance of better success.
And where's Joseph now?
He actually just went into a group home 3 months ago. A lot of my friends and family don't know that. But, you know, it just became where, you know, we couldn't work. You know, my husband had to retire early from his job. He also worked for the police department. And just the challenges, because when they get older, they get very difficult. They get physically aggressive a lot of times. So, you know, we were very lucky to have this resource to us, but it's a very big challenging and it affects your whole family.
And I can imagine such a difficult decision, you know, to turn the care of your child over to someone else, even though it's probably the right decision.
Well, you know, it is the best thing because, you know, he's lost about 30 pounds since he's been there. They have him on a diet, they have him exercising, but yes, it's heart-wrenching because you have a child who can't speak, they can't communicate, so you don't know how they're being treated, they can't tell you. You know, you just have to think that this is the best thing for them, and in fact, in New York, we have a very high waiting list. There's a very big waiting list. You know, there's not a lot of housing, there's not a lot of day hab opportunities, so that's the things that we'd like to see worked upon where there'd be more resources and help for the families, you know, because we really deal with my organization of the here and now for a better tomorrow. And, you know, just to be a group that, you know, is able to help one another with, like you were saying, about information and what's available out there. And there needs to be more. There needs to be a lot more.
And the one thing that families have said to me over the years, they said, our kids are going to outlive us.
Oh, that's my biggest fear.
What happens when we're gone? Who's going to take care of my son or my daughter, whatever the case may be? I'm sure that's something that's...
It keeps me up at night. I just think to myself, you know, obviously he's going to outlive me. So you just do the best you can and you try to prepare for their future. And, you know, with my organization, I have over 2,000 families. And I know that's the biggest fear for everyone, you know. And as I said before, my job was a very challenging job. I worked in, you know, very big units like the Organized Crime Control Bureau and Narcotics Division, but this is the biggest challenge.
So what can people do that, A, if they're going through this, you know, go back 14 years ago when parents are, say, what do I do next? And then also, what would you like to see done more, whether it be out of Albany, out of Washington, or wherever else?
Well, I think parents, they need to, if they're able to, and it's not easy for every parent to be an advocate. Some are very private, some are dealing with crises at home. They have siblings in the home that affects the siblings. So that's why there are so many advocates. I became an advocate because a friend of mine had a child the same age as my child. We sat and had coffee one day, and I was complaining about him leaving his dirty boots inside the kitchen door, and she said to me, I just hope I live one day longer than my son. And I said to myself, what parent wants to live longer than their child. She said, my siblings are not going to care for him. My parents are older. I'm getting older. I'm divorced, she said. You know, the divorce rate is very high in these families. It's really terrible. What I'd like to see in our state, and we have some great groups throughout the state working on it, is we seem to, as long as we keep funding early intervention, because the earliest interventions provide the best outcomes, we need to keep funding early intervention. With school programs, a lot of the school programs are doing better. They're creating autism classrooms. You know, we have 126 school districts on Long Island. We have the Department of Education in the city, districts throughout the state. Every district works differently. You'll have parents that will literally move from district to district for better services. And then we should see good transition services, because from 5 to 21, a person with autism is under the purview of state ed or the Department of Education in the city. When they turn 21, it's like they're slapped in the face, and they go from being in a very structured environment of being bused back and forth to school and having services and staff, to being in the world of OPWDD, where adult services is very challenging, and they are, you know, still trying to navigate this new system the state put in place, the front door. If they have a language barrier, they really can't maneuver it. And then there's very limited access to day hab programs, good day hab programs, that for the individuals that are able to be out in the community and working, that there are those programs preparing them for that, preparing them to be as independent as possible. And then the housing crisis. We have to think it's going to be a tsunami. Where are these people going to be housed? We had horrific things happen in this state. Our state was reactive to Willowbrook. They created a group home model, which is lovely. 6, 8, 10, 12 individuals to a home. It's very expensive to staff these homes. It's almost one-to-one staffing. A lot of nonprofit agencies are running these homes throughout the state. And direct care workers, when we talked about minimum wage in this state, direct care workers, they're caring for individuals that are often 250 pounds, nonverbal, very aggressive, and they're paid $10 and $12 an hour. And where can you hire staff to be with your adult child with autism and pay them that? I pay a babysitter more than that. So it's a crisis.
And finally, Suzanne, what would you have told you 14 years ago that you wish you knew then?
Well, I guess, you know, in the beginning I was in denial when I got my diagnosis incorrectly that he just had a speech delay. And I think that you have to fight hard and you have to advocate as hard as possible for your own child, because that's the only way that you're going to get proper services and make your child be the best that they can be. And, you know, in the beginning I was just hoping that, you know, he would acquire language, that he would get better. But now I've accepted the fact, unfortunately, you know, that he's going to have limited, you know, abilities. But to work with those abilities and to seek out the best resources for your child, the best teachers, the best programs, the best respite services. You know, I know with families, the thing that helped us a lot was the respite programs, to give your family members a break. You know, to know that if you need help, to reach out for it. You're not, you know, to me, I was used to being, you know, the police officer that I didn't think I needed help from anybody. But to rely on other people and to get within a network, like say an Autism Society local chapter, where other families will help you, where you can network and you can find the best resources for your children. And back to what Diane was saying about our direct care workers, you know, we have people that are going to be making more money flipping a hamburger than taking care of a child that needs, you know, really technical care. So I would like to see, you know, with our children, that they have access to good workers, not lose them to the fast food industry.
Well, it is Autism Awareness Month, and I've found a lot of people, until this comes into their life, don't realize the scope of this and how prevalent it is and the challenges. And I've talked to people very close, that from getting kids to get bused to school, to which schools will open the doors for them, to having to go through all the attorney fights and all the rest. I think regardless of wherever anybody falls in this, it shouldn't be that hard.
It shouldn't be.
And
Life
I know
shouldn't
you
be that
guys,
hard.
I know you guys are working to make it easier for folks, but thank you guys both. I appreciate the time.
Thank you.
Thank you
Our
very
pleasure.
much.